You won't hear this in a hospital. The fix that stopped my nightly bathroom trips in a single day is so simple you might chuckle, but it has changed the nights of hundreds of older adults I've treated. I'm Dr. Kenji Nakamura, an internist. I've spent my entire career in a small clinic in Matsumoto, in Nagano Prefecture, Japan. Even now, well into my 80s, I unlock those clinic doors every morning, and I went through this myself. There was a stretch when I woke up as many as 5 times a night and dreaded sunrise. Today I sleep straight through, and you could start feeling that shift as soon as tonight. When I first finished med school, I brushed this off. I tell patients, it's age. It happens. Then I reached that age and saw how these little things can wreck your quality of life. Waking up once or twice a night isn't just inconvenient. It chips away at health and joy. I lived it. Now imagine in later life getting a full, quiet night without a single wake-up. Most people assume nighttime bathroom trips are just part of getting older. My experience says otherwise. In 50 years of practice, I've learned a crucial lesson. Small habits can create big changes. Every morning, patients ask, "Doctor, how do you stay so sharp at your age?" I smile and say, because I sleep well. Good sleep is medicine, stronger than any pill. How many times did you get up last night? Have you noticed what that's doing to your days? A few years after I turned 70, I started waking 2 or 3 times a night. Fall and winter were worse. Without deep sleep, I woke with a pounding headache, lost focus during appointments, and sometimes nodded off at work. I even switched to slip-on slippers so I wouldn't trip at night. Only people who've lived this truly understand how life-changing the right fix can be. Once I nearly wrote the wrong prescription because I was so foggy. A nurse caught it in time. That night I told myself, this has to stop. I can't put patients at risk. I started looking for answers. One patient still stands out. Mr. Hiroshi Sato, 82. He was waking 6 times a night and had slipped into depression. "Doctor," he said, "I'm losing my mind without sleep. Life is torture." I can still see his exhausted face. He asked for sleeping pills, but after we worked on daily habits instead, his nighttime trips were cut in half within 2 weeks. And a month later, the depression signs were gone. When he told me, "You helped me feel human again," I felt a pride that's hard to describe. Another patient, Mrs. Yoko Takahashi, fell on her way to the bathroom one night and broke her hip. Recovery dragged on. Walking became difficult. She stopped going out and her mood crashed. Nighttime trips aren't just annoying, they can be dangerous. At home, we put night lights on in the hallway, and my wife started sleeping in a separate room because my tossing and turning kept her up. I tried medications, no luck. I had bladder ultrasounds, checked my prostate, nothing serious. Everyone told me the same thing. It's your age. I began forgetting long-time patient names and repeating the same stories at family dinners. My children worried. Later, I learned the simple truth. Chronic sleep loss was the culprit. Without enough deep sleep, the brain doesn't reset, and thinking suffers. Maybe you also believe frequent nighttime wake-ups are unavoidable. The story I'm about to share may change your mind. One evening, my wife said, "You always have broth at night and lots of fruit." That's where it started. I shifted when I drank fluids, and that very night I woke up fewer times. As I kept adjusting my routine, I began sleeping straight through. No pills, no procedures, no heroics. At first I doubted it. Could something this simple really work? Then I dug into the research and found the physiology to back it up. Fluid balance, circulation, hormone timing, each matters. I felt embarrassed that a veteran doctor had overlooked basics. My clinic staff noticed too. "Doctor, you look refreshed." The tired look faded. My focus with patients improved. And most important, I finally understood my patients better. Having lived it myself, I could offer advice that actually helped. That's why I recorded this video. If you stick with me to the end, the whole picture will make sense. Hitting subscribe and like helps this reach more people. As a physician, I'll say this plainly. I'm ashamed that for years I jumped straight to prescriptions and ignored lifestyle. The foundation. I want to pass that lesson on to you. Before you turn to pills or surgery, try 5 simple steps you can start tonight. I've used them myself and shared them with hundreds of patients. They're not a replacement for medical care. They're the missing piece. Often the simplest habits turn out to be the most effective. Are you still worrying about how many times you'll get up tonight? How would it feel if you didn't? Imagine waking up tomorrow rested, clear-headed, and steady. You can get there, and it can start this evening. Habit number 1. Set a hard cutoff for evening drinks. Most of the urine you make at night comes from what you drink in the evening. It takes about 3 to 4 hours for fluids to work their way through. So late day drinking is what drives those 2 a.m. trips. Your kidneys also behave differently by day and night. Daytime you're active and water clears faster. Nighttime the body tries to conserve fluid. With age that rhythm can slip, and your system may keep producing urine at night almost the way it does during the day. That's why what you drink after dinner has such a direct impact on nighttime bathroom runs. Take Aiko Tanaka, 74. She used to wake up twice a night. The very first evening she stopped drinking after 6 p.m. and skipped brothy soups. She woke up only once. If I'd known it was this simple, I would have started sooner, she said. She also moved her fruit and tea to earlier in the day, and the results stuck. Or Kenji Takahashi, 67. He loved a cold beer around 8 p.m. and paid for it with 3 bathroom trips a night. I explained that alcohol is a diuretic and suggested having a beer with lunch or cutting back. He resisted at first, then admitted, "Turns out I like sleeping more than beer." How to put it into practice. After 6 p.m., avoid water, broths, fruit, and alcohol. Choose mostly solid foods rather than soups. If soup is on the menu, eat the chunky part and leave the broth. If you're really thirsty, take a small sip. Don't chug. And if your mouth feels dry, try swishing water and spitting instead of swallowing. Be especially strict in the last 2 hours before bed. Of course, take your medications with the smallest amount of water needed. Remember the hidden fluids in foods like fruit, soups, and hot cereals. And don't overdo the restriction. Too little water can cause dehydration and constipation. Drink enough water during the day to keep your fluid balance. If you have kidney or heart disease, talk with your doctor before making changes. Everyone's right amount is different. Even a couple of spoonfuls of broth at night can tip the balance and change your night's sleep. Habit number 2. Tackle leg swelling to cut nighttime bathroom trips. All day long, fluid tends to settle on your lower legs. When you lie down, that fluid shifts back into your bloodstream. Your kidneys filter it and turn it into urine. That's a major reason people wake to pee. Doctors often call this gravity swelling. Upright gravity pulls fluid down. Flat, it heads back toward the heart. Take Hiroshi Tanabe, 77, a lifelong fisherman along the Hokkaido coast. Hours of standing left his legs swollen, and he was up 3 times a night. He started putting his legs up against the wall while watching TV, and his wake-ups dropped to 1. Hot weather used to make everything worse. Once he made a leg elevation a habit, he slept soundly year-round. Or Junko Saito, 71, who spent decades on her feet at a department store counter. Even after retiring, she still woke 3 times a night. I asked her to elevate her legs above heart level each evening and wear compression socks during the day. Within a week, she was getting up only once. How to do it. After dinner, raise your legs above your heart for 15 to 20 minutes. Rest them on pillows, stretch out on the couch, or lie on the bed while you read or watch TV. The most effective setup. Lie on the floor with your back flat and your legs up the wall so your body forms an L. Aim to do this every evening. A few cautions. If you have high blood pressure or heart issues, don't swing your legs up suddenly. Ease into it. Stop if you feel short of breath or chest pressure. If your feet tingle or go numb, change positions. If you have diabetes, check your feet for skin problems and use soft pillows to avoid pressure points. And if you have significant varicose veins, check with your doctor first. When you sit down to watch TV tonight, where will your legs be? Change that, and you may change your night too. Habit number 3. Make a pre-bed bathroom trip non-negotiable. Use the bathroom before you turn in, even if you don't feel the urge. If there's any urine in your bladder, you're more likely to notice it during sleep and wake up. At night, your body shifts into rest mode, but a filling bladder still sends a wake-up signal to the brain. With age, bladder capacity shrinks and the walls lose some elasticity. What you held easily at 300 to 400 milliliters, about 10 to 14 ounces when you were young, can feel urgent at just 150 to 200 milligrams, roughly 5 to 7 ounces later on. Sensitivity is higher at night too, so even a small amount can pull you out of a deep sleep. Take Sachiko Mori, 81. She made herself go every night before bed, whether she felt the urge or not. 3 months later, she stopped waking altogether. At first it felt inconvenient, she said, but now it's second nature and I finally sleep deeply. Sachiko used to nod right off after her evening show. Now she always makes the last stop first, even when she's tired. Or Takeshi Kobayashi, 84. Because of prostate enlargement, some urine stayed behind even after he went. I showed him a simple way to empty more completely. After finishing, men can gently press upward on the soft area between the scrotum and the anus, the perineum, to help release what's left. With that small change, Takeshi's nighttime wake-ups drop sharply. How to lock in the habit. Before you get into bed, go every time. Don't flop down just once. Take your time and focus on fully emptying. Try double voiding. Finish, wait 20 to 30 seconds, relax, and try again to clear the remainder. Pause a few extra seconds at the end to let the last drops pass. Many men find sitting down helps the pelvic muscles relax, so emptying is more complete. If you take diuretics for heart or kidney issues, ask your doctor about timing. Morning doses often cut down on nighttime trips. And tonight, do a quick mental check. When was your last bathroom visit? If it's been a while, make one more stop before lights out, just in case. Habit number 4. No phone in bed. Screen lights tell your brain it's daytime and nudges your body to make more urine. The blue light from your phone suppresses melatonin, the hormone that helps you fall and stay asleep. And it also disrupts the normal nighttime rise in antidiuretic hormone, ADH, which should help you make less urine overnight. And in stimulating or upsetting content, and your fight or flight system kicks in, making it even harder to drift off. Take Kazuo Sato, 79. He used to fall asleep doom scrolling the news. Once he stopped bringing his phone to bed and left it in another room, his nighttime wake-ups were cut in half. It felt odd at first, he told me, but now I sleep much deeper. He also realized late-night political headlines were winding him up. So he checks the news after dinner and reads something light before bed, and his nights are completely different. Or Yumi Nakamura, 68. Evening family group chats were her favorite ritual, and she messaged before bed until late. The alerts kept waking her. I asked her to cut off texting by 8 p.m. and park the phone in the living room overnight. A week later, she said, I miss the grandkid photos, but sleeping well matters more. What to do is simple. Leave the phone outside the bedroom. Ideally, shut down all screens an hour before bed. Keep the room dark, quiet, and comfortably cool. Swap screens for a paper book, a brief meditation, or gentle stretching. If you must read on a device, use the blue light filter. But paper is better. This isn't just about phones. TVs and tablets should be off at least an hour before bed, especially if the content is tense or exciting. If you use your phone as an alarm, switch it to airplane mode and leave it across the room, face down. Or better yet, use a basic alarm clock. If you usually fall asleep with a phone in your hand, try leaving it outside the bedroom tonight and see how you sleep. Habit number 5. Don't jump to the bathroom the second you wake up. Not every nighttime trip is about a full bladder. Often it's a learned routine. If you wake up and head to the bathroom a few nights in a row, your brain starts expecting it and nudges you awake at the same times, even when you don't really need to go. Sleep runs in cycles, and brief wake-ups at the end of a cycle are normal. If you get up every time, you cement the wake and go habit. The fix is to break that loop. Take Kaiko Watanabe, 81. She used to get up 4 times a night. Pausing felt hard at first, but she practiced staying in bed. Within 2 weeks, her wake-up calls dropped to 1. Those first days were tough, she said, but now I sometimes sleep straight through. Or Akira Fujimoto, 72, who had frequent night urination after prostate surgery. Beyond the medical piece, anxiety kept him on edge. He worried his bladder couldn't cope. I coached him to try a short relaxation and urge delay routine. When he woke, he stayed in bed and let the wave pass. He was nervous at first, but his confidence grew, and his wake-ups fell sharply. How to try it. When you wake up, don't spring out of bed. Stay still for 3 to 5 minutes and focus on slow breathing. Ask yourself if you truly need to go or just woke by habit. Close your eyes and see if you can resettle. A simple drill helps. Slow, deep inhale, even slower exhale. Soften your shoulders and jaw. Repeat 5 to 10 times. You may drift off again. Important, if you feel pain, strong discomfort, or clean urgency, don't force it. Get up. If you have BPH, incontinence, or other conditions, talk with your doctor. This approach is about stopping automatic, unnecessary wake-ups, not ignoring real signals. And do get checked if nighttime awakenings could be tied to diabetes, heart failure, sleep apnea, or other issues. Put one tip into action tonight. Pick a single change and start this evening. Stop fluids after dinner. Prop your legs up. Always go before bed. Park the screens outside the bedroom, or practice a short wait if you wake at night. One night can show you the difference. Don't try to perfect everything at once. That only adds stress. Start with one habit. If it helps, layer in the others over time. Several of my patients have even been able to taper off sleeping pills after making these shifts. Always with their doctor's guidance. Pills can knock you out, but they often hurt sleep quality and create dependence. Lifestyle fixes are safer and last longer. In 40+ years of practice, I've seen the same truth again and again. The simplest steps are often the most powerful. When nighttime bathroom trips fade, life improves fast. You wake up refreshed, the days feel easier, memory and focus sharpen, fall risk drops, and stress lifts. 5 quick steps at a glance. Stop fluids after 6 p.m. Elevate your legs above heart level each evening. Make a pre-bed bathroom trip non-negotiable. Keep phones and screens out of the bedroom. If you wake at night, pause and try to resettle before getting up. Even one change can help you feel better by tomorrow morning. I'm 70, and I still unlock my clinic doors every day. When people ask my secret, I give the same answer. Deep, healthy sleep. It's the foundation of a steady, satisfying older age.